Cancer research in India is a complex matter and it needs to balance public policy across many competing agendas. The article I found called for increased research capacity and training and protected time for clinical researchers, more support from states, and enhanced collaborative funding programs. In India, there is a need for a strong research agenda, but this fact has not been recognized in the country. This absence is a serious gap in public policy because strong research bases have been shown to substantially improve patient outcomes with benefits for human capital and wealth creation. It is mentioned that research systems must be able to cover both modern and traditional medicines like yoga, unani, siddha, and homeopathy in order to reach a broader audience. The article outlines some important points that the government needs to take care of, and it mentions that this is so important because of the large role that government plays in funding and in other aspects as well. For example, at one point, new regulatory requirements, the absence of transparency, and shifting legal grounds have caused for many trial activities to be delayed and sometimes suspended. This is a huge hindrance to research communities since it stops them from improving the existing health services. India still does not have developed a public health policies to guide the implementation of early detection strategies, a fact that is exacerbated by the fact that several key states still do not adequately support cancer research. Cancer researchers in India are improving their reputation compared with others in the world, but lacking government support can hinder this greatly. In order to develop tertiary research capacity and to create networks within India, there needs to be more support from states and from the central government itself. Unlike other places in the world, the government plays a large role in providing funding for research teams, while charities play a minor role. But even still, there is little funding for the cancer program, since funds available to support research are too low. The article concludes that a more value needs to be put towards cancer research by policymakers at state and national government levels, since cancer research is essential to deliver an affordable cancer care system in India. While the article takes an approach in stating how government can improve cancer research in order to take this research and apply it to members of society, the blog that I found looked at how government can affect an individual's need to get help themselves. In Colombia, an individual named Jorge Villarreal found a way to go around the country's law prohibiting abortions after several women died from complications in attempting to perform the abortions themselves. Rather than leave the women to fend for themselves, Villarreal created an independent institution where women could go get help from the complications of their abortions, and today it is used as a model for many other clinics in the world. Despite the laws put into place by the government, Villarreal was able to help those women in need. The technology that I found wasn't technically a technology itself, but rather ideas that came from an article that talked about how clinical researchers can use social media to gather the information because of the self-measurement tracking and personal habit tracking that people do, instead of reaching out to them and using money that may not be provided to them by the government. This way, research teams do not need to wait too long for adequate funding or adhere to strict rules that come from accepting the funds.